Let's understand how brain stroke happens to human. Brain stroke, also known as a stroke or cerebrovascular accident, CVA, is a medical condition that occurs when the blood supply to the brain is disrupted or reduced. This can happen when a blood vessel in the brain is blocked or ruptured, causing the brain cells to die due to lack of oxygen and nutrients. There are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes occur when a blood vessel in the brain is blocked by a blood clot, while hemorrhagic strokes occur when a blood vessel in the brain ruptures and causes bleeding. The symptoms of a stroke can vary depending on the location and severity of the damage, but common symptoms include sudden numbness or weakness on one side of the body, difficulty speaking or understanding speech, loss of vision or double vision, dizziness or loss of balance, and severe headache. Prompt medical attention is essential in the case of a stroke, as the sooner treatment is administered, the better the chances of recovery. Treatment options for a stroke may include medications, surgery, or rehabilitation therapy, depending on the type and severity of the stroke. How to overcome brain stroke affected. Overcoming the effects of a brain stroke can be a challenging and lengthy process. The specific course of treatment and rehabilitation will depend on the severity and type of stroke, as well as the individual's overall health and abilities. However, some general strategies for overcoming the effects of a brain stroke include getting immediate medical attention. The faster a stroke is treated, the better the chances of recovery. Seeking emergency medical attention as soon as possible can help prevent further damage to the brain. Medication. Depending on the type of stroke, medication may be prescribed to help dissolve blood clots or control bleeding. Rehabilitation therapy. Stroke survivors may benefit from various forms of rehabilitation therapy, such as physical therapy, occupational therapy, and speech therapy. These therapies can help improve strength, mobility, and cognitive function. Lifestyle changes. Making positive lifestyle changes, such as quitting smoking, improving the diet, and increasing physical activity, can help reduce the risk of future strokes and improve overall health. Emotional support. Recovering from a stroke can be emotionally challenging, and stroke survivors may benefit from counseling or support groups. Assistive devices. Assistive devices, such as canes, walkers, and wheelchairs, can help stroke survivors regain mobility and independence. It's important to remember that every stroke survivor's recovery journey is unique, and progress may vary. However, with the right treatment, rehabilitation, and support, many people are able to overcome the effects of a brain stroke and lead fulfilling lives. 10 important reasons why people's affected by brain stroke. There are several reasons why people may be affected by stroke, including high blood pressure. High blood pressure is one of the leading causes of stroke. If left untreated, it can cause damage to blood vessels in the brain, leading to stroke. Smoking. Smoking is a major risk factor for stroke. It can damage blood vessels and cause atherosclerosis, which can increase the risk of stroke. High cholesterol. High levels of cholesterol can lead to a buildup of plaque in the arteries, which can increase the risk of stroke. Diabetes. People with diabetes are at an increased risk of stroke due to the damage that high blood sugar can cause to blood vessels. Age. The risk of stroke increases with age, with people over the age of 55 being at higher risk. Family history. If a family member has had a stroke, the risk of stroke is higher for other family members. Obesity. Being overweight or obese can increase the risk of stroke due to the strain it puts on the cardiovascular system. Lack of physical activity. People who are physically inactive are at a higher risk of stroke than those who are physically active. Poor diet. A diet high in salt, saturated in trans fats, and low in fruits and vegetables can increase the risk of stroke. Stress. Chronic stress can increase the risk of stroke by contributing to high blood pressure, smoking, and other unhealthy behaviors.